I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More here.
Welcome to this episode of IDD Health Matters. Our guest today is Valerie Chadwick. She's a nurse with the ARC of Philadelphia. Welcome, Valerie.
Thank you very much.
So, Valerie, I understand you're relatively new to this field of IDD healthcare, right?
Yes.
How did you fall into it?
Okay, so I always had an interest, I think, in not an interest, but I've always been drawn to vulnerable people. So wanting to cover them, wanting to protect them. So the heart was always there. I think that, a lot of times being in public and engaging with people who had disabilities, there was a lot of hesitancy on my part, a lot of discomfort, a lack of confidence. Didn't want to do something to offend or say something to offend, but a lot of times, that personal space thing, getting in your personal space and me not wanting to reject them, but also not knowing how to handle myself in those situations. And I didn't want that. I wanted to be able to interact with people who had disabilities and who will present in different ways that I'm not used to encountering, but I wanted to be comfortable in those spaces. And so I sought that out and I found the ARC of Philadelphia. They had a volunteer program that I connected with, and that was my own pursuit, not just for my nursing career, but just for me personally to become more connected and more experienced with people who had disabilities that were different from myself.
Valerie, I love that. And I love the vulnerability and the way you express that, because that's a common thing, I think, it was common for me and for many of us that we feel uncomfortable in certain situations, and sometimes that keeps us from interacting just because we don't know the best way to do that. And
yes.
And you kind of took that and figured out how to grow and to be able to do that.
Yes.
That's really neat. So what work do you do with the ARC?
So with the ARC of Philadelphia, I am the health advocacy director of the program. So I am a nurse. I work per diem with another organization, but with the ARC of Philadelphia, I stand as the health advocacy director. We have a program. It was, what do you call it? It was an initiation or a program started by the ARC of the U.S. Quite a few years ago. It was grant funded. And so it was like, what's the word I'm looking for? Not copywritten, but it was like a thing. It was called Health Meet under the ARC. And so the grant has since run out, but the ARC of Philadelphia kept the program going. And so what it is knowing the lack of education and experience in medical schools, health professional schools in general, because as a nurse, I also, like I said, did not get that training. And so we are looking to supplement that until medical schools and dental schools are already on the run, specifically Penn Dental. Yep. So yeah, they're already there, but those know
Dr. Wolf there?
Yes.
Yep.
Yeah, so we do have a partnership with Penn Dental as well that we're working with within our program. But even allied health professions, so the PT, OT, things like that, we're looking to give all of those health professionals experience working with this population. And so right now we have partnerships with, I believe, every medical school in Philadelphia. Some nursing programs are coming on, PA programs are coming on, dental programs are coming on. We're working with one school's occupational therapy program. And we have a sister organization called Spark Services who has an adult day program. And so we are able to ask the participants there to volunteer to see the medical students and whomever other students come through the program, as well as the students coming and volunteering their time as well. So it's like a dual agreement. The participants are able to practice seeing the doctor or seeing the dentist or seeing a therapist, and then the medical students, dental students, therapy students, they practice taking care of people who have disabilities. And we always tell them the focus is not, get through this health screening. The focus is your one-on-one interaction with this population so that you become more comfortable and more versed in this population that is just as much a part of the community as everyone else.
Okay, Valerie, you're speaking my language.
Yes.
Totally.
Yes, sir. I
'Cause
told you I check into Health Matters, so I know.
well, first of all, I appreciate that. And when we met today and you started talking about all this, I'm like, you got to be on the show because you totally get it. And that is so needed. We have to provide training to healthcare providers. If you're not trained to do some nursing skill, you're not going to do it very well. When I'm not trained to do some medical skill, I'm not going to do it very well.
Right.
And training is so important. And I look at it as we are not effectively training in most healthcare programs how to meet the basic healthcare needs of millions of people with intellectual and developmental disabilities in this country. And we've got to do better. And I love what you guys are doing with this.
Thank you.
So how many people come through the program, or what does it look like on a day-to-day basis?
So I'm not the numbers girl, but
Okay,
we've had a few hundred students, I believe. So I also started the program in July of last year. So I'm just shy of a year being there. So it's been going on for quite a few years. I want to say maybe 5 years.
You've reached hundreds or thousands of healthcare providers by this point over the last several years.
I definitely know it's been hundreds, and that's just during my time there. So I'm pretty certain that if we haven't hit the 1,000 mark, that we're probably close to that. Yeah.
Well, each one is a step in the right direction. Each person that you're able to improve their understanding and their connection with people with intellectual and developmental disabilities makes a huge difference.
Yes.
Yeah. So what are some of the or do you have maybe a story or two of someone that has come through the program and their eyes were just opened and they see things differently, or some sort of inspirational moment maybe that you've seen happen?
I personally like to see the students when they come through at the end of the screening. So in the beginning, we give them like a 45-minute kind of, not lecture, but like an informational session on like the history of disability, how home and community-based services became a thing, just giving them a backdrop of what they're walking into. And then they go and do the health promotion. And from the time that they hit the door, we do it in the nurse's office. So from the time they hit the door of Spark Services, though, it's just like everyone wants to engage them. They're coming to introduce themselves. They want to know who the students are coming through. And, the students, when they're with the patients, the things that they've said are the things that we want to is the hope and the goal. It's like, what you came in here thinking, if it wasn't accurate because you were going based off of a preconceived notion, we want to bring these people before you and you develop a more true, accurate picture of who these people are because you've experienced them, not something that you've heard or something that you've seen, but your own personal encounters. And I think that is so important because they shine. Like you assume even the ones who are nonverbal or, their primary mode of communication is not verbal. They may not be able to answer your question verbally, but when you ask them to do something or when you explain something to them, they're able to follow. And so what you thought was incompetence, you find out that it is competence, but it's just shown in a different way.
Yep. And, one of the first things we talk about in communicating is presume competence.
Yes.
Talk to the person. If you're a healthcare provider, talk to the person in front of you and not just the person who comes with that person.
And we foster that so we have 2 students that usually come and volunteer. And so one will be the practitioner and the other will be the scribe. And so what I encourage is the practitioner, the one who is sitting before the patient, talk to your patient. Your scribe will pick up blood pressure. Your blood pressure was 118/76. That's pretty good. Not the blood pressure was 118/76. Talk to your patient. Yep. Again, even if they can't respond to you or they're unable to verbally, say, okay, well, thank you. It's not that they don't understand or that they even don't want to know. Like, just because they can't verbalize that doesn't mean that they're not curious, that they want to be included. And so that's also something that I'm able to express to them. Like, you may have the caregiver there, respect the caregiver, love the caregiver. We get a lot of resourceful information. You never want to leave them out, but you're taking care of your patient in front of you, not the caregiver. So make sure that you engage your patient. And so that's also something that's kind of thrown in there during the health promotion exercise too.
I love all of this. Now, you really decided on your own that you just wanted to be a part of this or understand this group better and do what you do? Like, you had no previous experiences, you actively sought it out.
Yes.
That is, I'm just going to tell you, that is really unusual. Usually people come into this field, either they have a family member or someone that they knew growing up that influenced them and they want to, work in this field, or they kind of fall into it by accident. But you actually sought it out, and that's pretty neat. That's pretty impressive.
Yeah.
So what are your plans in the future with the organization or wherever else related to this field?
I want to take it as far as I can go in regards to the Arc of Philadelphia. But I do have a desire, and this is being put on the World Wide Web, so now I'm even more accountable, but I do have a desire to go to medical school. That's always been the goal, the dream. My desire, or, the thing that I was interested in most was cardiology. But being in this practice, shout out to Dr. Mary Stevens from Jefferson. I was able to shadow her and see her work. And when I looked at her in action, I saw myself wanting to do what I saw her do. She has a doctor's office that caters specifically to people who have intellectual and developmental disabilities. That's not the whole, what's the word?
It's not her whole practice, but just
right,
a significant part of it.
Catering to those, even in regards to times, like, it's not that 15-minute window, but they're able to extend their time that they see them. Accessibility to the utmost, wheelchair skills, accessible exam chairs, things like that. And just seeing her and the help that she's able to provide people who get turned away because physicians aren't comfortable or don't know how to care for people who present differently, even in a office space where they may make certain noises or need a certain level of noise, to be able to be comfortable. And, just catering to a community that seems to be so overlooked and underserved in that way. I saw myself doing that. So ultimately, I'm going to ride it out with the Arc of Philadelphia for as long as I possibly can. And the can will be interrupted by medical school. So that's like that's a goal. That's a thing in the works for me. It's not going to be like overnight. So I'm with the ARC. As far as I know, I'm with the ARC. And even in medical school, I just see myself being that advocate, staying connected in some way, form, or fashion to advocacy when it comes to people with disabilities. But that's the ultimate goal. So ARC of Philadelphia advocacy into medicine, medical practice, continuing advocacy.
Valerie, when in the first 2 minutes I met you, you're going to achieve those goals. I know that already about you. You're pretty determined and have a clear path, and it'll be great to see you moving forward. And we're coming to you today from the Developmental Disabilities Nurses Association Conference. We're in Orlando. This is 2024.
Yes.
And this is your first one, right?
Yes. Mm-hmm.
Okay. What do you think about the conference so far?
It was amazing to be amongst so many other nurses who have so much, years of experience, 50 years, 40 years, 30 years, and to see them, continue in this field, the experience that they've gained, and even, seeing how much more work there is to be done, seeing the work that has been done, being encouraged by that, but also seeing that there's so much more work that needs to be done. And so it's been a wonderful experience. I am overloaded with information. I have so much to look back on. I'm so glad they offered the slides to us because it's so much information, but it was what I was looking for. Even your the article that you wrote with Lee.
Oh yeah,
the
Unlocking Behaviors.
Yes.
For that, it's in the Helen Journal of Human Exceptionality. We do a series, myself along with a behavior analyst, and we talk about behaviors and then the medical underlying potential reasons for that, as well as the psychological components. So check that out.
And that is what I was looking for. That's what I always look for, because I know that behavior is a form of communication, especially for people who don't use audible voices. And so even in my nursing practice for now, I look for education on how I can better assess my patients, because things will present differently. They will present differently. And so that was literally what I was looking for. That's what I've been looking for, even in listening to your podcast. So to be able to find another jewel, I'm so appreciative. And it came from being here.
Well, I'm going to give you another jewel on this, since you have an interest specifically in that. One of the other things that I've developed that we have at our company, Intellectability, is the curriculum in IDD healthcare. So it's a e-learn course that's geared specifically to healthcare providers. You'll get nursing continuing education units or physician continuing education units. There's a whole module just on behaviors and how those can be signs of underlying medical conditions, and you're gonna get that.
Thank you.
Yeah, absolutely. So, gosh. And that was the other thing I wanted to tell you about. So we're at DDNA, Developmental Disabilities Nurses Association. When you go through medical school, I'm not sure if you're aware of this organization, but it's another organization I'm a part of. It's the American Academy of Developmental Medicine and Dentistry, AADMD.
Yes.
And we have medical school chapters as well as, it's a great organization to learn more about this field. Great collaboration between physicians in the field of different specialties, as well as dentists and medical students. So keep that in mind as well, too. And for everybody else out there, too, that's another great organization.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So, Valerie, one of the things that I like to do on the show is I ask people, I call it 3 in 3. It's 3 things in 3 minutes that you would like the audience to know that you think would have a positive impact on people with intellectual and developmental disabilities, or for them, or improve health and wellness. Just kind of tips, things you picked up along the way that you think other people should know about.
Yes. See people in their humanity. People, when I say people, I mean everybody, but the context here is people with IDD. So they have needs, they have desires, they have likes, they have dislikes, they have hurts, they have happiness, they have sadness. Anything that impacts you impacts them. And so see them in their humanity. Ultimately, the golden rule, treat people the way that you would want to be treated. Treat someone the way you would want somebody to treat your mom or your dad or someone that you cherish and love so much. So see everybody, specifically people with IDD, in their humanity and value them. Treat them as such. Like, treat them with the value that they have, because they were created for a purpose and they're here for a purpose, and they are valuable just because of that alone. So see them in their humanity. And the other thing is, we said it already, presume competence. So please don't think that because someone cannot communicate with you the way that the traditional way, with their voices, with, just the way that we're used to communicating with people. Please don't assume that they don't understand, or that they don't want to know, or that they're not interested. Please take the time to meet people where they are. And again, just assume competence. Like, assume that people know what you're saying. They desire to know what you're saying. They desire your time and your patience and your attention. Just presume competence. And then lastly, the things that we're looking to do in the IDD world in regards to impact and making a difference, it can look like a huge mountain, and it is. But everybody holds a little space in the world. Everybody has their own little space, their own people that they're connected to, their own networks. Serve where you are. Make a difference with those 1 or 2 or 3 or 4, or even just starting with the one, make a difference with that one person who has some type of disability or who has some type of difference, and you will be making a world of difference because you will make a difference in their world. So yeah, those will be my 3 nuggets that I would share.
Valerie, those are way more than nuggets. Those are words to live by, really, in every aspect of our lives. You have a wonderful just presence and a wonderful vision and a wonderful view on life. And I am first thankful that you spent some time with us today on the show, but more thankful for you being involved in this field and for the work that you do. And I can't wait to see what you do in the future.
Thank you.